When is radiation an option for AVMs?
So radiation, otherwise more appropriately called stereotactic radiosurgery, is an option for AVMs that are typically located in areas of the brain that would be considered too high risk for surgical resection. So this would include the motor cortex, which is the area of the brain that controls movement in the arms and legs, as well as the muscles of the face. The language cortex, which allows you to both interpret language being spoken to you, as well as generating language from your own mouth. Those are both language cortex regions. Vision cortex, the area of the brain in the back of the head that allows us to see and perceive shapes and objects. That if an AVM is located in that area, surgery may cause a vision deficit and radiation may be more appropriate. And then finally, there are what I call the deep structures of the brainstem and the thalamus. And these are areas of the brain that are more like relay stations or routers between the brain and the spinal cord. And operating in those areas is generally high risk. And if an AVM appears in those areas, radiation is often a better choice. There are a couple other situations in which radiation may be the first choice of treatment for an AVM. Another situation that would fall into that category is if a patient has other medical issues or comorbidities that would make an anesthesia, general anesthetic difficult or surgery difficult. So for example, if somebody has diseases or disorders of their lung or their heart where anesthesia would be high risk, it may be safer in those patients to treat the AVM with focused radiation. And lastly, radiation is an option for AVM patients in patients who are looking for a non-invasive treatment option. If the AVM is not symptomatic and a patient wants to avoid surgery, radiation is an excellent choice for those patients.
If you like this video, don't forget to subscribe.